I mean, at the end of the day, it's about serving people, right? It's serve and protect. Sometimes you have to protect people from themselves.
Officer Zach Hudson says people in crisis need more than a mandatory stay in a mental health unit, often called a Baker Act.
I personally have Baker Acted people 7 times in a row.
Lake Mary cops have developed a mental health intervention group, combining law enforcement, healthcare, business, and faith-based groups to provide an elevated level of care, including counseling, once a person is released from the Baker Act.
What we're trying to do is provide that care once they get back home and make sure it's being provided in their house.
More than continuing care after a hospital stay, the Mental Health Collective is hoping that some people can be helped right away, perhaps avoiding a need to go to the hospital for that mental health stay.
The goal is able to see patients sooner rather than later during their time of crisis, so we can prevent them from having to go to the hospital.
Try to get people their medication. That's number one.
A local pharmacy, recognizing some people require but stop taking prescribed drugs, will deliver to their house, including people who may not be able to pay.
If people who don't have insurance or have, they can't pay their co-payments or something like that, we try to help them out.
Cops say it's about better outcomes for everybody.
Every time you have contact with that individual, the chances go up that they're going to seriously hurt themselves, hurt you, or kill themselves.
In Lake Mary, Dave McDaniel, West 2 News.
And Lake Mary police say they hope that this can provide solutions for those in crisis rather than repeated hospital stays.